जाने ठाउँ कहाँ जाने हो र त्यतिकै बस्नु होला के त्यो सहेरै बस्नुपर्ने होला के अब
When we are interpreting, as a human being, you're just not interpreting the words, but sometimes we come across the emotions, and that time it's challenging. You cannot react. Your job is just to interpret, but as a human being, it's just like something goes inside, and still you need to be professional. Those are the challenging moments.
The woman who I was working with seemed what I'll call as like a typical Nepali middle-aged woman. We were into the treatment when she was just taken over by an overwhelming kind of a wave of emotion. The treatment became something different. It was about the domestic violence that she is experiencing, the beating, the ridicule, the day-to-day torment that she's receiving. It just kind of blew me away.
It's not like you can go live in a women's shelter here. There aren't any. You go and live on the street with your children, which also happens in the United States as well. But it's more literally, I think, about survival. We opened another satellite clinic, so it's about a half-an-hour walk.
You can also lay her down if that would be better. We have those cushions.
There was a 50-year-old male. I was needling actually near him. So Sheila, the interpreter, said to Andrew, seizure, he's having a seizure. And
Let's see if he gets oriented to where he is. Husband, okay. And your husband, he had a stroke, is that correct? 1 year ago? And did it happen suddenly? Just one day, suddenly he couldn't walk anymore. Okay. Can he speak? No, cannot speak. Okay. How does he communicate with you? Move his head? He can shake like this? Okay, yeah, all right. Do you know where you are? Yeah. Okay. Yeah, okay, all right. All right.
But I think the thing that kind of was the most, I guess, disturbing for me was that it was his wife that was with him. So I just really had a lot of empathy for her. And I mean, when you have somebody that has this kind of condition, you can't leave them alone all day. So can she work? Does she have any support? How is she taking care of the both of them? I mean, I think that's the role that we play, is just to be available to them and provide some support, and even for the wife to just know that, if something happens, that he's taken care of for 30 minutes twice a week.
She's putting on weight. I think the treatment is working. Maybe it's slow, but
yes, I think us working with the hospital doctors is a good idea.
मेरो विचारमा हाम्रो उपचार हामी उहाँलाई उपचार गर्ने र हस्पिटल डाक्टर सँगै काम गर्छ नि.
Every day is important.
हरेक दिन एकदम महत्त्वपूर्ण छ.
Always ask yourself, What's best? Okay, the little girl we saw today with the RA, is it best for us to treat her or is it best for us to refer? Hard to know.
I don't know, they can't afford it.
Yeah, right, exactly. We may be all she's got. We have to use acupuncture needles and some herbs to try to treat this very severe disease that's crippling this little girl. Yeah, well.
Yeah, I need to come here as well as her. It doesn't work if she misses here. So which day should we come?
Wednesday, Friday?
बुधबार कि त शुक्रबार?
Yeah, well,
For here.
Okay.
यहाँको लागि हुन्छ हैन?
बुधबार
कि त शुक्रबार?
Keeping it. Oh.
Oh, man.
Take two. One of my goals is to not get attacked by monkeys. Well, when I think about going home right now, there's some mixed emotions. It's going to be sad leaving here, knowing, how important this clinic and the work is to the community.
I think I have 4 days left at the clinic. I'm entertaining the fantasy that I will never leave at this point.
After we leave, there'll be a new group that comes, and things will continue as they do.
Andrew is teaching us not only from a Chinese point of view, but comparing with the Western medicine. We are learning through a microscope about tissues.
The function of those tissues and those cells in our body and how they work.
It's our main focus right now is to figure out how to train a local practitioner that can be here year-round.
We'll have him write his name again, okay, when he gets the needles out. You tell me if you notice a difference then, okay? We're seeing results in conditions like stroke. Their strokes were, 10 months to several years ago. And, in the States, they would say it's been too long to regain any function back in your left side, your left hand. And these people are regaining function and sensation back in their affected limbs or their speech, their ability to eat, chew, swallow. It's phenomenal because, functioning here, physical functioning, is how you survive.
One afternoon, I realized that I had spent the majority of the day just touching people's feet. It seems like such a simple gesture, but it was really significant for me. We recognize the humanness in another person when we can see their pain and be with their suffering in a compassionate way. It's what happens in the treatment room every day.
Keeping people out of pain and able to work affords people the opportunity to support their families here.
This clinic, once I leave, continues on, and the patients continue to be treated.
I just want to be part of this dream and hope that we can expand more and more and provide our service to many people. I think hope is always going to be alive.
We also look at what our practitioners take back from this experience, the knowledge of how they did it, and now they get to take that back to their respective communities and do it 1,000 more times. That is where the payoff for the project is, beyond the walls of this clinic.